Welcome to The Explainer. Today we are diving deep into diabetes mellitus. But we're not just reciting facts. We're framing everything as practical, evidence-based counseling points specifically for you, the pharmacist. We're going to follow a patient's journey, right from that initial diagnosis all the way through to long-term management.
So here's our roadmap. We'll kick things off with the diagnosis itself. Then we'll clear up the difference between type 1 and type 2. After that, we build the foundations of self-care, tackle the big topic of insulin, and then wrap it all up with the key drug classes you'll be talking about every single day. All right, let's start at the very beginning. Picture a patient just told they have diabetes. The first thing they're probably thinking is, what does that even mean for me? So we need a clear, simple answer. When you're explaining this, it really helps to boil it all down to one key player, the hormone insulin. You can tell them it's one of two problems. Either their body's insulin factory isn't making enough, or the body just isn't using the insulin correctly. Either way, the result is the same, too much sugar in the blood. And that's what we need to manage to prevent problems down the road. Now, how do we make the diagnosis official? It's all about the numbers. For a patient, seeing their own lab result next to one of these numbers is where it gets real. These aren't just abstract figures. They are the clear lines in the sand that confirm the diagnosis, whether it's a fasting sugar, their A1C, or a random blood test. Okay, so once a patient understands that they have diabetes, the very next question is always, okay, but which type? And getting this distinction right is absolutely critical for everything that follows. Here's a great way to explain the difference. Think of it like this. With type 1, the body's insulin factory has been shut down. The body's own immune system mistakenly attacked it, so there's an absolute lack of insulin. Now, type 2 is different. The factory is still running, but the body cells have become resistant. They're ignoring the insulin. It's like the key isn't fitting in the lock properly anymore. And this is such an important piece of context for counseling, especially for that newly diagnosed type 2 patient. You can show them this and say, hey, look, you are not alone, not by a long shot. A whopping 90% of all diabetes cases are type 2. That can really help normalize the diagnosis and reduce that initial feeling of isolation. Now, before we even think about medications, we have to build the foundation. This is all about empowering the patient, giving them the tools to take control of their own health. These are the absolute cornerstones. Take glucose monitoring. We can frame it as their own personal dashboard. It's not about good or bad numbers, it's about getting data. It shows them in real time how that meal or that walk affected their body. These aren't just chores. These points, especially things as simple as daily foot checks, are what put the patient back in the driver's seat. All right, let's tackle the big one, insulin. For a lot of patients, that word alone can be really intimidating. So our job is to demystify it and focus on what really matters for using it safely and effectively. This table is basically our cheat sheet for explaining why timing is so crucial. A great analogy is mealtime versus background insulin. The rapid-acting stuff is for meals, a quick burst to cover the food they're about to eat. The long-acting insulin, on the other hand, is the background. It's the slow, steady supply that keeps things stable all day and all night. Okay, if there is one safety conversation you have to absolutely nail, it's this one: hypoglycemia, or low blood sugar. This isn't just a nice to know. Every single patient on insulin needs to be 100% confident they can spot it and treat it. The goal here is to teach patients to listen for their body's fire alarm, the early signs, that shaky, sweaty, hungry feeling. That's the smoke detector beeping. We want them to act then, right away. We don't want them to wait until the whole house is on fire, with the later, more dangerous signs like confusion. And what do they do when that alarm goes off? We give them the rule of 15. It's incredibly simple and easy to remember in a pinch. 15 grams of fast sugar, wait 15 minutes, and then check again. That's their emergency action plan. It's empowering, and they need to know it by heart. Beyond lows, there are a few other pro tips. We have to talk about rotating injection sites. Why? To avoid those lumpy spots that can really mess with how insulin is absorbed. Proper storage is another big one. You don't want someone leaving their insulin in a hot car. And for new type 1s, giving them a heads up about the honeymoon phase can prevent a lot of confusion when their insulin needs suddenly drop for a while. All right, let's switch gears and move on to the key non-insulin medications, focusing on the ones you'll see most often in type 2 diabetes. For each one, we'll hit the mechanism, the side effects, and the top counseling point. First up, the king of type 2 meds, metformin. The biggest hurdle right out of the gate is usually an upset stomach, so our counseling is all about managing that. Take it with food. We'll start you on a low dose and go up slowly.
It makes all the difference. And, of course, the vital sick day rule. If you get really ill and can't stay hydrated, you need to stop taking it until you're better.
Next, we have the SGLT2 inhibitors. These work by making you pee out extra sugar, which is pretty clever. But our counseling has to be balanced. On one hand, we need to be upfront about the risk of urinary and yeast infections and the need to stay hydrated. But on the other hand, the benefits are a game changer. We're talking powerful protection for the heart and kidneys. It's a huge win. Now for the GLP-1 agonists. With these, managing expectations is everything. They work by slowing the stomach down, so nausea is very common at first. The key phrase here is start low, go slow. We need to reassure patients that this usually gets much better with time. And then you mention the big bonus that gets everyone's attention, the potential for weight loss. That's a powerful motivator.
Then we have the DPP-4 inhibitors. You can think of these as the gentle option. They are incredibly well tolerated. Honestly, the best counseling point is to talk about what they don't do. They have a very low risk of causing low blood sugar, and they don't affect weight. This makes them a really solid choice, especially when side effect concerns are high. Finally, let's talk about an older class, the sulfonylureas. With these, our counseling needs to be laser-focused on one thing, the high risk of hypoglycemia. These drugs force the pancreas to release insulin, whether you've eaten or not. So the number one non-negotiable rule is simple. You can never skip a meal when you're on this medication, period.
So, we've covered a ton of ground, right? From diagnosis to all these different medications. But let's bring it all home. When that patient is standing right there in front of you, what is the single most important message you want them to walk away with? Because at the end of the day, that's our real job. It's not just about sticking a label on a vial. We're translators. We take all this complex medical science and turn it into simple, manageable, daily actions. We turn confusion into confidence and fear into empowerment. And that is how we help our patients not just manage their diabetes, but truly live well with it.